to share you some insight on androgenetic alopecia in children. It's not that unusual to have alopecia areata in children, as you know that the onset of the condition is often at a young age. In children, you should always ask for family history, as family history is very common, and both family history and the early age of onset are a bad prognostic factor as to response to treatment. It is easy to diagnose alopecia areata when it has several patches or when you have alopecia areata totalis or universalis, but when you have a single patch of alopecia areata, you should make a differential diagnosis between tinea capitis and trichotillomania. And of course, differential diagnosis mainly rely on trichoscopy. Clinically, alopecia areata patches are with very sharp margins. In most of the cases, the shape is circular or oval, and there are no signs of inflammation, so no redness, no induration, no scales. And here you see a typical trichoscopy picture. Differential diagnosis with trichotillomania and tinea capitis is really easy if you are a bit practical in trichoscopy. And of course, look at the whole scalp. Don't forget the hairline attachment of phaeasis, which is quite common in children and represent a chronic form of alopecia areata. And of course, trichoscopy helps it because it shows the typical sign of acute alopecia areata, namely black dots, dystrophic broken hair, while in chronic alopecia areata, you see these groups of yellow dots or a real carpet of yellow dots indicating follicles that are not able to produce a new anagen hair. We have seen that trichoscopy helps to diagnose alopecia areata and also helps to allow phase of alopecia areata. You should assess the patch by trichoscopy and also assess the apparently normal scalp, as you can have an early diffusion of alopecia areata and you can detect it before the diffuser loss, treating the whole scalp. What are the trichoscopy signs in alopecia areata? Here you see the list. Most commonly, they are seen all together. So you see the black dots indicate of acute damage, the yellow dot, more chronic, dystrophic hair, but sometimes you see them isolated. Here you see black dot, acute damage to the anagen hair follicle, and they can also be seen in the dark scalp, as they really are evident against even the dark background. Here you see the pathogenesis of alopecia areata and of black dot. The acute damage to the anagen matrix cells, which are actively proliferating, induces stop of proliferation, detachment of the hair shaft, and remnants of a fragment of the matrix within the follicle. And this is what you see from the outside by trichoscopy. So again, you see the black dot, you see it at histopathology, the remnant of an hair shaft in the follicular ostium, and here you see trichoscopy. Of course, you should always put together trichoscopy feature and history, as black dot are a sign of anagen effluvium, so not only seen in alopecia areata.